guys, I'm back. I grabbed my other phone, and the reason why I was using that phone, a lot of the girls say with my new phone, they're not really getting the notifications. Okay, so I got my new phone out. Okay, so I'm sorry, you guys. I got the phone and I need to learn to use it. Okay, so no, we won't have any interruptions in regards to my lives. I just got to get used to using it. This is a Samsung and my iPhone, but a lot of the ladies said they have a hard time getting the notifications for some reason. So set up your notifications, making sure that it is there. Shannon, come here for a second. Yeah, setting up the notifications. That type. Answer that phone for me while I do my live. Yeah, and so, see, that would have been another interruption. So a lot of our topics were on the Clubhouse in regards to, the coordination and the coordinators. And you guys, I can't keep telling you the coordinators are not your friend. And so one of the things you guys want to do is you want to make a checklist of the things, because I had another young lady who they did not weigh her, they did not take her blood pressure or anything, and then later they called her and told her that there was something wrong with her weight, and they didn't even weigh her. And I remember the young lady that they didn't do her height, and they called her and said that, there's a discrepancy in her height. So we want to make a checklist, ladies. I want to give you a checklist for those that haven't had a chance to replay the Clubhouse. The checklist is making sure, first of all, you guys, you need a urine culture done when you do your labs. They're not going to tell you everything because they're saving some shit. Okay, go ahead and get a urine culture done so you'll know if there's any traces of protein in your urine, anything that they might see, because they're supposed to do a urine. And this young lady, they didn't do a urine, but then they started to tell her that she needed a urine as well. If in fact your urine is being pulled, you need to make sure that they test it in front of you. Don't let them walk off. No way. Hey, I have a right. I have a right to see you do that in front of me. Start practicing and exhibiting your rights. You don't have to let them do what the hell they want to do. You can stop or no. Because I'm the patient. I will prefer that you do that in front of me so we can see the results together. It's okay to ask that. You guys don't ask the questions that it's okay to ask because you think you'll be intimidated that they're going to cancel you. You guys also need to remember, coordinators are not doctors or nurses. Stop telling them your fucking business. Okay? If she starts asking you questions when it comes to your medical issues and stuff, ma'am, I'm not comfortable with that. I've discussed this over with my doctor, and my doctor and I discussed this, and my doctor did send in my clearance letter. And if I need to discuss this, I would rather discuss it with the surgeon that's doing my surgery, or discuss this with the anesthesiologist. But you guys are telling them too much of your business. Hold on one second.
Okay. So Tandra said they rescheduled, well, not rescheduled, but Dr. Payne is no longer available to do her surgery. For the next 6 months, he's unavailable. So they rescheduled her to do it with Dr. Miller, you said? Do you know a Dr. Miller?
It depends on what doctor. Yeah, excuse me. This is another cancellation type of thing. So Dr. Payne is not doing surgery for the next 6 months. Anybody on here got Dr. Payne? Because we got somebody now telling her that Dr. Payne is not doing surgeries for the next 6 months. Tell her to tell them if they can hold on a minute. She wants to go out because she actually have been talking to Dr. Payne's nurse at his private office. If she can step out for a minute, she'd like to get that confirmed because she wants to call Dr. Payne's private practice right now. And then she'll make that decision once she calls over there because she has been in contact with him through his private practice. And let's see what she says.
Okay.
Okay.
So, Tandra.
Okay, you guys see that? So the next 6 months, you guys, apparently Dr. Payne is not doing surgeries and they're trying to send her to Dr. Miller. Did y'all hear what I just told her to tell them? Okay? Because have you contacted all the women that are supposed to have surgery with Dr. Payne within the next 6 months? First of all, the young lady has gotten here. We just picked her up. I'm going to tell y'all quickly that story. And then we're going to talk about, the information that we shared. Okay, she had not been able to get in touch with the coordinator. Okay, and so we called, and because we didn't know whether or not Dr. Payne is doing surgery at another facility. However, she called to get her where the pre-op was going to be with Dr. Payne. Never once did they mention that Dr. Payne's not having surgery. Okay, so then they give her the address and everything. Now, mind you, she did not, and I asked her, is that Jolie? And they said, oh, they didn't know. So how the hell you work for them and you don't know the address you just gave her is Jolie, but yet you the one answering the phone. So next they, we went there. Then the coordinator mysteriously emails her and says, oh, by the way, we don't have your PTT or your INR, okay, lab work. But guess what? She listened to me. She had a copy of all of that. She says, I have it right here, Miss Tammy. She said, do you believe that coordinator just after trying to get in touch with her before for the past 5 days, and she is a military nurse and she's traveling, so she's up on point, and she says, I got it right here. Now that she gets there, they tell her, oh, he's not going to be able to do her surgery for the next 6 months because he's not there. And that they want to send her to Dr. Miller. And so you see what I told her. I said, okay, y'all want to play games? Let's play games. All right. Tell her you're going to get back and answer that question after you get in touch with Dr. Payne's assistant from his private practice, because you've been in contact with him and her, and let's see how they play this out. Okay. So see, this is what we're talking about. Just now, a prime example of the games that they play. So anybody that got Dr. Payne, from what I'm understanding, you guys need to get on the phone and verify and confirm if Dr. Payne actually not be doing your surgery, because the next 6 months is a lot of time. That's a long time, so that's going to catch a lot of y'all. So put it out. From what we just heard, Dr. Payne will not be doing surgery for the next 6 months. Ooh, the plot thickens. So let's go ahead and see. We be at there. I'm telling you, he always align things up where it needs to be. What a coincidence that we're sitting here talking about these goddamn coordinators, okay? So, but one of the things is she's so prepared that now they fuck it. He can't do your surgery, right? Because we trying to cancel you, or we trying to do some other stuff and all of this here stuff. And they thought they had her with the PTT and the INR, and I said the worst case scenario when I dropped her off, I was like, the worst case scenario, they're going to tell you that the anesthesiologist is going to need to read it, and then, it might be another day, so we're going to have to wait. So at the end of the day, they had no plans on doing her surgery today at all. Okay, and so Dr. Miller is actually from Miami Aesthetic Center, so he might be struggling because he's a new doctor. So now what they want to do is get clients for him. So if you guys replayed the Clubhouse, one of the conversations was about waiting into desperation that they get us here and then they make us try to choose another doctor. So we're going to see how that plays out. So again, you guys, one of the things that we talked about is preserving your PIR information. I remember when I had my surgery, they give specific things that they want you to have to be tested on your lab work. I told my doctor I do not want them to send anything else other than what they asked for. We talked about that, okay? And when this so-called secretary who has a title called coordinator starts asking you your medical information, tell her to mind the business that pay her, because that's my business, and at this point I am not comfortable discussing that with you. You guys be spilling your whole damn life with her, and she be like, okay, you know, that she's not a medical, and she needs to prove that. Okay, prove to me that you are a medical provider, and why do I need to give you my medical history? And if it is, can I talk to the person that is making that decision? Okay, because I discussed this over with my doctor. You know, anything that's going on with you guys, you know, you guys put it down on your paperwork. Don't put stuff you don't need to put down, because it's a need to know basis. We're giving them too much information. That's why they're fucking with us the way they do. Okay, you don't have to disclose. It's a HIPAA violation. You're violating my HIPAA right to privacy. Okay, and it's a need to know basis. I'm not comfortable sharing my information with a secretary. I'll call her just that, with a secretary. Okay, you're to put a file together. If I'm missing something out of it, let me know. But as me discussing my business with you and telling you stuff and calling her and saying, oh, I took my lab and it says this and it says that, you need to specifically speak to the stuff that they're asking for. If your doctor seems fit to clear you, then they don't need to know anything else about it. If in fact you have something that's questionable, or your doctor is questionable, because remember, your doctor, your PCP did your lab work, and I don't care if some shit is in red or it's this or that. Ask him, does that hinder you from your ability to have this type of procedure? You guys need to also make sure that you talk to the one that it makes a difference to. The only difference that it's going to make to these coordinators is whether they're going to cancel you or not. Okay, you're going to give them an opportunity to bank a cancellation and book another girl and keep your money. So we got to get smart, okay, and not give them more than what they're asking for. So that's basically some of what we were talking about. One of the young ladies did talk about, you know, being canceled with Dr. Williams for visceral fat. You guys all know that is Dr. Williams' go-to when he is. It's almost like back pain and back injury. It's something that's hard to detect, and it's something that you won't be able to know whether it's true or not. So again, anybody that's going to Dr. Williams, then I think you need to talk with your PCP in regards to, or we need to call a specialist that is designed for that, because when Dr. Williams is overbooked, the first thing he tells you is you have visceral fat. And one of the things is I've challenged that, because he's told a couple of girls that, and they actually went to another doctor and had great results, and they did not say that they had visceral fat. What he's trying to say is, you too fat, and I'm not about to do that shit. That's what he is. Or you got too much loose skin, you got too much hanging skin, and all of that, you know. So again, you know, just having these good conversations. I really felt good about the conversations, because it's clarity. I want you guys to visualize the flow. We talked about, you know, how you start booking and when you should start recording and documenting. How to document, we're going to continue to talk about that. How to cover your own ass. Okay, so we're going to do a series of conversations, a series of conversations on, you know, rebuttals and how do you speak to them, and what do you say, just like see how quickly I told her, okay, let her know you will confirm and verify what the hell she's saying. I'm in contact with Dr. Payne. I'm going to call his private practice. I'm going to talk with his assistant, and I will make a decision after I talk to them. Okay? Because now the cat's out the bag. You know, I have a young lady who's a good friend of mine who's coming with her husband, who I am going to need to get in touch with, because she will definitely dig deeper, because she's actually scheduled to go to Dr. Payne within the next 6 months. So again, are they just lying? Let's see. Because they say, I bet you they said that shit so professionally. Oh, honey, Dr. Payne is not going to be working in the office for the next 6 months. So they the lie was told so far in advance that they closed her in, that they want to leave her with only one option. Baby, if you want your surgery, you're going to go to Dr. Miller, okay? Because we ain't no rescheduling no time soon. Dr. Payne ain't about to do no surgery in the next 6 months, okay? By that time, we about to get her name. We about to blow the spot up today. Okay, and we about to trap her off in her damn lie. Oh yes, when I get off of this here live, we getting ready to cause some damage. We getting ready to make some noise. We getting ready to blow up the phones, because every girl gonna be calling that got Dr. Payne and be like, what? Because they profiled her and didn't know she had reach. She got reach because she got me. So now we each one teach one. We about to teach. She about to learn today, and we about to be the one to teach her. Stop the fucking lying. Stop the lying. Okay? Yeah. So at the end of the day, apparently Dr. Miller is suffering with clients. Okay? The young lady one of the young ladies on the Clubhouse talked about that. Talked about what they was trying to force her to go to another doctor. And at this point, she said, Miss Tamer, I'd rather come back home with nothing than to come back home not sure of who they trying to send me to. I've never heard of Dr. Alvarez. I didn't sign up for Dr. Alvarez, and then sometimes these new doctors, how you just jump in the game and all of a sudden you a $9,500 surgeon and shit. And you, like when they did that with Dr. Triggs. Dr. Triggs ain't even been in plastic surgery that goddamn long, ain't even proved itself, just moved here, and you gonna move a patient from Sampson to Triggs. Sampson improved himself, but you want me to pay him Sampson prices. Where they do that at? Y'all do that. That's what y'all do that. Y'all be like, okay. Because all you want is the surgery. And so at the end of the day, if nothing changes, nothing changes. We gotta change the game, y'all. Just see how fast they just ran game on the wrong one. The wrong one. Because we get ready to get to the bottom of that. Okay? Shannon. She closed the door. I wanted to see. So I'll follow up with y'all on how that went. But again, that's how we have to stand up for ourselves. Because they thought, this young lady is very mild. But she's strong. They don't even know who she is. She got reach in the military and everything. You guys just, they judge a book by the cover. They thought they saw something weak. They've been playing games. But the fact is, she's been challenging that coordinator. That coordinator thought they mad because she came equipped. They said they didn't have this. She had her paperwork. Like I told y'all, bring a copy of everything. Because trust and believe, they gonna all. This woman ain't called her back all week. Supposed to send her email letting her know where her pre-op is and everything. Okay, then when she called, they pretended like they didn't know where, who, what. Let me see, you know what I'm saying? And then gave her the address to Jolie, like they didn't know who Jolie was. By the time she got off the phone, I was already headed to Jolie. I said, baby, I got you. I already know what to do. All I need to do is hear the beat and I can name that motherfucking tune. Okay. Then I pulled up and I said, baby, just keep in mind before you go in there, they're either going to try to reschedule you. Because right now they're asking for something that needs to be viewed. And so today, being a Monday, there's less likely that they're going to view it. They're going to tell you that the anesthesiologist needs to look at it, the doctor needs to look at it, and this, and that. They went even one step further. They done went and canceled this man's whole program for the next 6 months. You can go to Dr. Miller. I met Dr. Miller. I did. And Serena. This is so funny. Those were the first 2 people I met when I went to Miami Aesthetic Center when I was running around on location. Dr. Miller and Serena were walking the building. So, can you get that for me? My phone will never stop ringing, you guys. So, guys, go back to Clubhouse if you have not joined. Go back. I made a list of, I had them write down a couple of lists and of things to do, especially at pre-op. Just like they got a checklist, you got a checklist. So if you want to know what that list is, Miss Tammy on Clubhouse, last night's podcast group room. So you want to have surgery and you're coming to Miami, and get your list together. But right now, y'all, I got some shit to handle. So I'm going to have to get off of here and go handle my business and go take care of my girl, because they got some shit in the game. And I will let y'all know how it turns out. And if I have to go on location, I'm going to bring y'all with me. I ain't been on location in a minute, but something tell me we going in. Miss Tammy, I'm out.